So that's interesting. So let me give you a quick overview of today's presentation. I will begin with some background. How was the strategy developed? What led to the current strategy? And then I will present the strategic goals and also explain how implementation and monitoring are organized. Also give you some insight in our current review process, which we're going under this year. And I will end with some reflections of synergies with the EU Global Health Strategy. Okay. Oh, now it worked. Great. So let's take a step back to where it all began. In 2013, Germany adopted its first ever concept of global health, the strategic paper Shaping Global Health. It was a pioneering interministerial document adopted by the whole government. It framed global health as a shared responsibility and positioned Germany as an active and also multilateral player. And one of the core innovations back then was a participatory process. So the concept paper was already developed with civil society and academic institutions together. But since then, the global context changed dramatically, as you all well know. We have growing disease outbreaks. The Ebola pandemic started shortly after the strategic paper was adopted, and also geopolitical developments and the increase of climate-driven health risks changed the way we need to approach global health. That's why in 2018, the coalition agreement of the new government stated clearly that we need a strategy and not just a concept strategy that is built from the ground up to address those changes. And the Federal Ministry of Health took the lead and coordinating role in this, steering an interministerial and cross-sectoral process. And what truly stands out, again, is the structured input from 5 stakeholder groups, so even bigger than before, with civil society, academia, youth, business, and think tanks. And every group submitted a strategic paper, which led to, which helped shape the strategy from the ground up. And beyond those formal consultation steps, we also shared updates on the strategy development throughout the development process with those stakeholders, and also used those opportunities to gather feedback, very valuable feedback, sometimes feedback that hurts, but that's helping us grow. And we're engaged with those stakeholder groups in those open discussions. The strategy defines 3 overarching goals valid for the period from 2020 to 2030, including a midterm review in this year. And those are first to improve the health of all people worldwide with a human rights-based approach to leave no one behind, and also to contribute to achieving the health-related SDGs of the 2030 agenda, and also to ensure that Germany's engagement is effective and sustainable. And these goals provide the overarching framework for action and coordination across sectors and actors. It's delayed a little bit, so yeah. Okay, so the strategy defines 5 thematic priority areas. The first one is the promotion of health and disease prevention. This includes access to essential services, prevention programs, and health literacy. The second one is to mitigate the effects of climate change on health. we do this with an One Health approach, addressing also environmental health and resilience building. The third one is the strengthening of health systems, especially in low and middle income countries, with a focus on governance, workforce, and financing. And the fourth one, maybe very currently important one, is health protection and the addressing of cross-border health risks and threats, from pandemic prevention, preparedness and response, over to AMR, over to global health security mechanism. This is all in this fourth priority. And the last one is research and innovation, also supporting global health research and development, digital health, and equitable access to technologies. Over those 5 priority areas, overarching, we emphasize multi-actor collaboration with international institutions and non-state actors, which again includes civil society, science, the private sector, and youth. And this is the continuation of the process we started in the development of the strategy. And of course, this would be nothing without coherence. So we also apply a whole of government approach, ensuring that health is systematically considered across all sectors. So also trade, education, climate, digital policy. Ooh. Okay. Implementation and monitoring. The strategy is being implemented through a broad range of concrete activities contributing to the 5 priority areas. And what also stands out is that the federal ministry is coordinating the strategy and monitoring the implementation. And we work across multiple formats. So those include funding and project work, also networking and committee engagement, as well as dialogue, campaigning, and stakeholder events. And I cannot emphasize this enough. A close cooperation with non-state actors is very important to us, involving regular consultations, information sharing, and also joint activities. And as I already mentioned, this is a strategy adopted and carried out by the whole government. So we, of course, apply the health in all policies approach. But no one can do global health without partners. So Germany's partnerships extend across regions and also institutions. On a national level, it includes the already mentioned non-state actors, but also the mobilization of technical expertise. In Germany, you all well know the Robert Koch Institute, and also the strengthening of Germany as a hub for global health. We are hosting the Hub for Epidemic and Pandemic Intelligence in Berlin. We also work closely with WHO, AFRO, Africa CDC, and the African Union, as well as Eastern Partnership countries and BRIC states. In global forums, Germany is engaged in the G7, G20, and also EU health structures like the ECDC, and also in the Global Outbreak Alert and Response Network, in which the EU plays an important role too. Germany is also a strong supporter of multilateral structures, which played an important role in the strategy that started in 2013 and plays an even bigger role now. For example, we were pleased to host the WHO Investment Round event at the World Health Summit last year, together with France and Norway. I don't see Jerome anymore. Yeah, but with France and Norway. And we also support the sustainable financing of not only the WHO, but also other parts of the global health architecture. Coherence requires coordination across ministries and partners. To achieve this, we use our yearly state secretary level GeoFix, which also gives us the opportunity to adapt to current events throughout the life cycle of the strategy, and also monthly interministerial coordination meetings, and also several working groups on different levels, informal and formal. And we promote, again, the dialogue with non-state actors, and also the strategic and financial support of other forums. So, for example, the World Health Summit or the Global Health Hub Germany, to extend discussions even further. In addition, we also promote the deployment of German expertise and young professionals in international organizations, for example, through the Junior Professional Officer Program or the Youth Delegate Program. And of course, coherence is also assessed as part of the midterm review. Oh no, that was too fast. Okay. I already mentioned it a couple of times, so let's take a quick deep dive into our review process. We are currently in the year of the midterm review, but this review itself didn't start just this year. It's a key step in the strategy's life cycle, so preparations were already made at the end of 2023, as it is our goal to make this process as transparent and participatory as possible. And the review has several objectives. We want to reflect on the implementation of the strategy across all 5 thematic priorities, and also ensure the strategy reflects new challenges such as health impacts of climate change, geopolitical instability, or changes in the global health architecture. And the goal is to present a concise progress report outlining the government's focus for the next 5 years, but within the existing priorities. So it's not a formal evaluation or a rewrite of the strategy. And the whole review process is led by the Federal Ministry of Health in collaboration with other ministries. We use a combination of different methods. So internally, so interministerially, we conduct surveys and structured feedback. And we do that by also making use of existing coordination formats. We also actively consult non-state actors using the Global Health Hub Germany primarily as our main dialogue platform. And finally, we reach out to international partners, including EU institutions and the WHO, to gather external perspectives. For example, by discussing the strategy in settings like the World Health Summit last year, a session which we also hosted together with France. And we see the review not just as a technical step, but as a strategic opportunity to strengthen what works, but also to correct the course if needed and prepare the ground for possible continuation of the strategy beyond the year 2030. Our national strategy is well aligned with the EU Global Health Strategy. The German Institute for International and Security Affairs assessed overlaps across 10 areas and found strong synergy in key fields. The lower the number you see in this table, the higher the level of synergy. So you can see we have high synergy in areas like cross-border health threats, One Health, and research and development, as well as strengthening the WHO and digitalization of health systems. And this is also an important basis for joint implementation and also strategic coherence at a European level. We also support innovation-friendly regulations and coordinations within the EU to advance health technologies. This is something that is also written in our strategy. And beyond that, Germany also fully supports the EU Commission's effort to strengthen WHO as a key partner in the global health architecture. So to conclude, Germany's global health strategy is a forward-looking, inclusive framework that reflects our values and also our global responsibility. We look forward to learning from the midterm review and to continuing our collaboration with EU partners and also all of you, multilateral organizations and non-state actors. And thank you very much for your attention.